I think Harun touched upon it earlier, and it was to do with training of professionals. And actually, I think there's an arm of campaigns that is often forgotten when you're so focused towards getting that message out to the community directly, thinking about those indirect ways that those messages can get through. And the other thing was that I was going to mention was around accessing sexual health services not always being at the point where you're in crisis or where you're needing to access treatment because or something's gone wrong, but getting into the routine of regular screening as well, I think is something that is a message that needs to be consistently shared across, which can then eradicate some of that stigma or fear of accessing services.
Again, we are thinking from UK perspective because we are in the UK and then we are talking about communities in the UK. Which is a good thing. But unfortunately, we don't have sexual health education in the schools. And I strongly believe that this needs to change.
It really varies between schools. Some schools are a lot more proactive than others. Of course, when the RSC legislation came in, and specifically talking about LGBTQ plus relationships, I think when it comes to anything queer sexual health related, it's definitely not there unless you're in a very progressive area.
Maybe colleges have a focus, so therefore there could be more campaigns, mythbusters around kind of stigma around kind of HIV and STIs and MPOX and stuff. Maybe there could be more campaigns targeted amongst colleges, like 16 plus.
I was going to, but at the same time though, Dan, although if you target it towards colleges, once again, if you're going to be getting people which have got a lower educational attainment, they're the ones who are going to face more health inequalities later on in life. So I think it's, and once again, this also needs to be reflected within campaigns where we're looking at language, really simplifying the language down, using slang language, using everyday terminology, which is going to be accessible for people who finish school at 16, right the way to people who are, studied masters and postgrad.
The other thing I will say is what Makinder said is really important. I particularly really focusing on changing the language and shifting there, making it basic. Nobody would like to talk about protein inhibitors when it comes to HIV treatment, even if they know about it. But when you make it very basic and when you tell it to people, then people understand what that virus does or that disease, that condition does and how the treatment works. They just kind of, in a very basic level, they just really embrace it much better